is Tom Lee, Editor-in-Chief of NEJM Catalyst, and we're continuing our discussions of diversity in the C-suite of healthcare organizations, which I think has been established in some of our previous podcasts and articles as something that is not about political correctness, it's really about performance. You need a diverse C-suite in order to perform as well as you can for a variety of reasons. But we won't go into that today any more deeply. We're going to talk instead to Odette Bolano, who's President and CEO of St. Alphonsus Regional Medical Center in Boise, Idaho, part of the Trinity System. Odette was born and raised in Bogota, Colombia. In between Bogota and Boise, she came to the United States for her education and her training as a nurse, and soon she got a master's in healthcare administration. She then took on a range of managing positions in HCA and became a CEO at the age of 33 for the first time at Doctors Hospital, a tenant facility in Dallas. Since then, she has had roles in the Ascension System, at Kaiser Permanente, and now Trinity. Odette, you've been at St. Alphonsus for 5 years now, but before we talk about what it's like being a Hispanic female CEO in Boise, can you tell us a bit about St. Alphonsus and how it fits in the Trinity system?
Yes, thank you, Tom. So St. Alphonsus Health System is part of the Trinity Health System, which is one of the largest Catholic health systems in the country. Probably 5 years ago, people didn't know where Boise, Idaho was, and it was a wonderfully kept secret of this beautiful area. And today, it really is a booming area with lots of growth. So for Trinity, who is in 22 states, this 4-hospital health system is very important from a growth and carrying out our mission of serving our communities and really being here in a way that makes a difference through Catholic healthcare.
Now, one of my favorite parts of your St. Alphonsus story is that there was this brief period where you left St. Alphonsus, moved to Miami for a job, and then was asked to return as CEO just 1 month later, and you did. Can you tell us how that happened?
Yeah, so I moved to actually Fort Lauderdale, and my history is I started in my senior leader career with Columbia HCA. I was with them for about 10 and a half, 11 years, and then I moved over to Ascension, and I was with them for 11 years. So I went from for-profit to non-for-profit faith-based healthcare. And then I got an incredible opportunity to go to Kaiser to really understand what vertically integrated full-service healthcare was, right, in a very different way. I loved Kaiser, but really my passion is with Catholic healthcare. I actually, I believe that sometimes you take a lateral move in your career to do what really is your passion. So I came to St. Alphonsus as the president and CEO of our trauma center. And during that time I was here, I got an opportunity to really explore private equity and join a turnaround in private equity. And it was a really, really difficult decision for me to leave. But my history has always shown me that I'm a person that loves to take calculated risk, learn, challenge myself. So with a very deep, deep heart, I left and went to private equity and was learning a tremendous amount. And then there was a change in Boise around the CEO position for the health system. And I got to tell you, Tom, the outcry from physicians to community to board members to Trinity, requesting if I would consider coming back was just very humbling. And I just thought, I've always been very committed to Catholic healthcare. I loved Trinity, loved St. Alphonsus and the work that we have been doing here for 125 years, and made a really difficult decision to go ahead after a very short period of time, leave that private equity work and come back. So, I laugh at myself because I sold a house here, bought one in Fort Myers, and then turned around and sold that house and came back to Boise and bought a smaller house for more money at a higher interest rate. So, it was definitely not because of the housing market that I moved around, but the passion that I have about Catholic healthcare.
I have wondered that whether you had time to furnish your home in Florida before turning around and moving back. But regardless of whether you did or not, I am sure that it must have been really deep passion that made you move back after picking up and moving cross country as you did. But now let's turn a little deeper to your story, because the fact is there aren't that many Hispanic CEOs in U.S. healthcare, or women, or nurses, and you're all three. I know there's going to be a lot of interest in your story, and what would you say are the top success ingredients, the most important success ingredients that account for your moving into CEO roles at a very early age?
So I grew up in a household full of healthcare. My relatives, my father is a retired pediatrician. My mom was a director of laboratory services at a hospital. I have many uncles that are physicians. I have a brother that's a physician, one that's a dentist. I mean, it is, sadly to say, maybe I just wasn't courageous to explore outside of the medical field, but it was something that was truly a calling from an early age, watching my family and how they served. And I always had a deep passion for leadership. I mean, I knew that whatever I did, I wanted to do it in a way that I would be successful in leading. And I think my father was really instrumental. I'm the only daughter. I have three brothers, and a Hispanic family. We immigrated when I was 8. So very protective Hispanic father. But what he really gave me, and what I saw my mother do, is never allow anybody to limit your dreams, and never allow your belief that because you're a woman, you can't do what you want. And my mother, worked her whole life. She was a professional. So I had great people showing me the way of how to move forward. So I think that we all decide on our careers based on what feels comfortable and how we learn, and then how we want to get to our dream. So for me, knowing that I wanted to get into leadership, and knowing that I wanted to do something in healthcare, I really decided that nursing was the way to go. And being able to really understand the front lines of how things happen in healthcare through the eyes of a nurse, being a nurse, was really the way that I felt I would get the best education to be a good leader and to really lead within healthcare. So I went to nursing school knowing that I wanted to be a CEO of a hospital. I mean, at that time, my dream was be a CEO of a hospital, right? Change has occurred over the last 30 years in a way that, my horizons were broadened as I really got into healthcare. So just the passion that my parents had to make sure that I was able to have the education, the upbringing, the values to truly get to whatever it was that I needed to be fulfilled, was really the main ingredient. And I would say that you have to identify mentors along the way, and I had some incredible mentors. I think that you also learn maybe supervisors and leaders that you've had in your life that maybe didn't do a great job, right? And paying attention to what things maybe didn't go well for them as a learning opportunity is also a way to, shape your career and shape your leadership roles. But for me, really being in the front lines, being able to have conversations with nurses, with respiratory therapists, with physicians all along, understanding what they do every single day, has been really what allowed me to have the success that I think that I've had.
Well, that's really interesting, and I don't know that I've heard that perspective articulated before. That being a nurse positions you really well to be, a CEO, because you really understand what the key stakeholders are going through. You understand what patients are going through. You understand what doctors and other clinicians and other staff are going through, and you really, really grasp it because you're interacting with those people all day long. That's a very valuable perspective that I think a lot of people are going to, pause and think about. But now there is a difference between being a good and effective manager and making the leap to being the CEO. And how did you make that transition at, the age of 33? How was it that Tennant wanted you to be a CEO? And how did you feel at that time about your own readiness for that role?
Yeah, so I grew up in the hospital system, and I was a nurse. Then I became a director. Then I became a chief nursing officer. Then I became a chief operating officer. Moving from a small hospital to a bigger hospital as a CNO, and the same thing as a COO. I would say that you know, AHA, Columbia HCA really prepared me. They challenged me. They gave me assignments. They gave me stretch assignments. They had a development program. And I think all of those things help you. But I saw that, I had progressed pretty much through most of the senior leadership positions, with the exception of the CFO, right? I call myself a closet CFO, that always took on stretch assignments. So for Columbia HCA, in the midst of the first huge corporate integrity agreement, right back in whatever year that was, in the late 1990s, I volunteered myself, even though I already had a full-time job as a COO, to be the integrity and compliance officer for the hospital that I was working at. And, there was a requirement that it be a senior leader to take on that role. And I, barely knew much, but I took on that role because I knew that HCA would give me the opportunity and the learning. So I've always put myself in a way that I was planning for my next move and making sure that I was taking on challenging stretch assignments, that I was voraciously reading, learning, exposing myself to seminars, and ACHE has been a part of my life since when I was a student. And I just at that point felt like, gosh, I've really done and succeeded in all my senior leader roles. And I think you're never really ready. If you're ready, maybe you should think that you sat in that position way too long, right? Too much comfort. But I really believe in taking calculated risk and challenging yourself. You never learn if you don't challenge yourself, if you're not uncomfortable. And so I felt I was getting comfortable, could do, the COO position with my eyes closed. And so it was time to take on a new challenge. And Tennant gave me that opportunity.
Well, that's a valuable description you just gave, because it makes me think, leaders are both born and made. You have certain personality characteristics which you were born with and came out of your family environment, but then you worked really hard. But then also, you alluded to the fact that HCA had programs where they were systematically trying to help people like you develop. And so it's very important, I think, for great organizations to have programs like that to, to bring along the next generation of leaders. Now, when you go places where there are going to be challenges, as you have throughout your career, there have to be some pretty tough days. Can you give an example of a crisis and how you worked through it?
Well, gosh, the most recent one is what we're living today, right? Which is the pandemic and the vaccines. And I mean, there's always challenges, but I think that the greatest one in my career that I will, you know, remember forever is what we're experiencing, not only as a country, but as a society, a global society. And I think, early on, when there was a lot of uncertainty and a lot of unknown, it was really important um, for me to really convey to the organization that I didn't have all the answers and that we would work through this together and that we would, have a course and have to change it. And we had to respect that it wasn't because we were just doing things for the sake of doing things, but things were changing and we were learning so rapidly and we were having to change course that it's important to allow your leaders to know it's okay to be uncertain. It's okay to be vulnerable. As a team, we will continue to move forward in this space. And I think that, for my organization, I coined grace, compassion, and understanding. I write something that I call reflection every 2 weeks to all of our colleagues. And it's just my thoughts of what's happened over the last 2 weeks, and hopefully people getting to know me not only as a leader, but as a person who's leading them, through time. And in one of those early on, I had read a poem that we're all in the same storm, but we're all in different boats. Some people may be in a yacht, some people may be in a canoe with a hole in it. We're all going through the storm and we're all experiencing something different. And so every day and every interaction has to be filled with grace, compassion, and understanding. And being visible, being present, I think is really important where you're going through something that has people unsettled, not only professionally, but personally. And so I think high visibility, continual communication, even when you have to come out and say, we know we said this 5 hours ago, but now we're changing course, and this is the reason why, is really important. People understand that you're human, you're allowing to be vulnerable, you're being humble. And people don't want a leader that thinks that they know everything. And you have to trust your team, and you have to allow the experts. Just because you're the CEO doesn't mean that you are the expert, and you have to allow those experts to be in charge when the time is right for them to be the ones that are calling the shots. So I think that, all of that is how you handle crisis, um, allowing your team to have some downtime, allowing them to make mistakes, um, and acknowledging that we only learn by our mistakes, right? We all learn by things that we did great, but not as deeply as when we have a mistake or an error or a false start. So I think that has been extremely beneficial for me. And I think um, holding on to your values is really important. It's easy sometimes when you're feeling pretty vulnerable and you're feeling at risk to maybe slide on your values. And I think that's really dangerous because if you allow your values to somewhat be compromised in the slightest way, the next time it's easier and easier to compromise your values. And so for me, integrity and reverence and transparency really are at the heart of how I lead and how I judge everything that I do.
Now, have you felt that there were times where being a Hispanic or a woman or a nurse was working against you in your management roles, and how did you deal with it?
Yeah. So let me start with the nurse. I think sometimes um, just early on in my senior leadership, nursing leaders were not at the same level as, let's say, the chief operating officer. Um, and I really pushed. to show up as a leader, to have executive presence, to really be bold and understanding of I was not only representing nursing as the CNO, but I was representing the organization. And I think it took CNOs, so that's in the 90s, I think it took CNOs quite a bit of time to really be able to be at the table. And some were at the table much earlier than others because I think of their ability to really understand the more broader picture of the organization while stating the importance of nursing, who makes up 60 to 70% of the workforce. So I think I learned early on watching maybe other peers or CNO that I had in my lifetime about how could I show up differently that I would have a much broader seat and voice at the table. I would say that even though I was an only girl in, a family of, 3 other siblings, my parents never allowed me. It just never entered my mind that my gender would be a limiting factor for me. So I really never focused on that, but I do remember a time, which I won't name, when I, was going for a CEO position, and somebody who I respected quite well, when I told him I was gonna, a boss, when I told him I was gonna put my name in for the position, I was telling the person who one of the people I would have to interview, said, you're probably the most qualified person, but I need a male in this position. That was the first time that I ever felt, very directly that my gender was seen as potentially a barrier for me to move in my career. I didn't let that hold me up. I didn't make a big deal of it. I just, pushed forward and continued to work on, what I knew were the skills that I needed to continue to hone in on. So that was the probably most like in my face time that I felt being a woman was an issue. But I didn't let it affect me too long. The only other time, which is I think just a fun story, is I was on a board and I was going to my first meeting, and this was in Texas. And it was CEOs that really made up this board. It was a purchasing group that we all owned a part of and were on the board. And so we usually had a dinner before the meeting the next morning. And so I walked in. I knew some of the people, but it was really, new for me because I was new to that board. And everybody was mingling for a while. And then somebody that I knew came over, and I was the only female in that room. Again, I didn't even really realize that. And he came over and he whispered, these are, wonderful Texas men, came and whispered in my ear and he said, Deb, we cannot sit down for dinner until you sit down. And I thought that was such a cute story, such a cute thing. They wanted to be respectful because I was the only female in the room, but I was very conscious that night that I was the only female in the room. But other than those two times, I do have a passion for women because it has become such a discussion point that, I really have made it my mission to help elevate women to their greatest potential.
Well, now let's wrap up with this, so that if you could go back in time and give advice to a young Odette Bolano, like the young woman in her early 30s with 2 young kids who was just starting to rise as a manager, what 2 or 3 things would you emphasize the most?
Yeah, what I would say is leadership is not about having all the answers, but admitting that you don't have the answers and inviting others to the table. I think humility and vulnerability play an important part of leadership, and I think every young leader doesn't realize that, right? That comes with maturity, but oh boy, is it so important. And realizing that it takes a village, and never forget that failure is part of growing and challenging the status quo.
The way you describe it, Odette, it makes me feel almost like women have an unfair advantage in becoming leaders compared to men, at least the stereotype of men. Uh, it's been a real pleasure getting to know you in this last year and better today. And I know it's going to be great to watch as your career unfolds. And thank you so much for sharing some of your insights with our audience today.
Thank you, Tom. It's been a privilege. Thank you so much.